Hello and welcome to EMR Optimization for Cancer Screening, PS Suite EMR. This video is training module number 3 and the topic is the Preventive Care Summary Report. Please take a moment to review our speaker disclosure slide. The objectives of this training video are to help PS Suite users understand the purpose of the Preventive Care Summary Report and how it works, and learn the major differences between searches and the summary report. So let's get right into it. The main purpose of the Preventive Care Summary Report is to calculate the preventive care bonuses that are available for patient enrollment model family physicians. Some physicians find this report helpful as it is easy to set up and run with only a few steps. The report works by performing a built-in search to categorize all eligible patients into 3 distinct categories for each screening type. These categories are patients who have had a screening test done, patients who have not had a screening test done, and patients who are excluded from screening due to factors in their medical history. So here's what the summary report actually looks like. As you can see, the type of preventive care activity is listed on the far left. For each activity, the report gives the number of patients in each category up to the end of the reporting period, which is defined as the end of the fiscal year by default. By clicking any of the numbers in this report, you can bring up the list of patients in that category. So the summary report is a simple way to keep track of your screening activity throughout the year. Now we do want to caution you around using this tool. Because the report works similar to searches, some people think that they can just run the report instead of doing cancer screening searches on their own. However, there are some key differences between the cancer screening searches that we have recommended and the Preventive Care Summary Report. First, your searches can be customized. This means that you can always make changes to your searches to make sure they follow Cancer Care Ontario's screening guidelines and recommendations. The Preventive Care Summary Report is built into the system and cannot be modified. For practices using older versions of PS Suite, the criteria may be outdated and the report may be missing patients who require screening. Cancer screening searches can also differentiate between average risk and high-risk patients. You can do this by adding criteria that identifies patients at higher risk. This is helpful because patients at high risk may need to be screened differently or more frequently. The Preventive Care Summary Report assumes all patients are at average risk. Lastly, our colorectal cancer screening search can identify patients who are up to date for screening by fecal occult blood test, colonoscopy, and flexible sigmoidoscopy. In contrast, the summary report will only track patients who are up to date with fecal occult blood test. That brings us to the end of training module number 3. Additional resources are available for this module. Our tip sheet provides details on the specific criteria used by the Preventive Care Summary Report to categorize patients. More information on the report, as well as step-by-step instructions for running the report, can be found in your PS Suite EMR user manual. Before you move on, please take a moment to complete the short quiz that will test what you've learned in this module. Our next video topic is on using reminders for cancer screening. Thanks very much for watching.